Come on, sweet girl. Go see the dentist. People don't understand our world. Everything takes on a different meaning. Let's go. Let's go to the dentist. Hi.
Good morning.
Good morning.
Well, almost all of our patients are unable to be seen in a regular dental clinic.
You learn to carry all your medical history with you so you can fill out forms.
They have behavioral disorders, they have an inability to control their head and neck muscles, and that makes it a really dangerous situation for them to be seen in a regular dentist's office because, you know, if you're sticking sharp instruments into somebody's mouth, they have to be still for you.
I gotta put my total trust in them. She can't speak, she can't tell me what's going on, but if she's happy, that's all that's important.
Good morning, Henry.
Oh, see, he's a little tipsy.
Families of patients with developmental disabilities often have a very hard time finding someone who can treat their loved one. A lot of our patients will drive hours and hours to get here.
There you go. So I don't know if he has to be, you know, to the extent where he's totally under.
It's an all-day event for a lot of these families, just getting the patient here, going to their appointment and getting the patient back home requires a family effort. A lot of times the entire family comes for the appointment because that's what it takes.
But she's a sweetie when she's awake.
We see 4,500 plus patients in this 2,500 square foot dental clinic. And you know, it's pandemonium a lot of days, but we get it done.
If you build it, they will come. That's what's happened.
The need for this clinic is real. We may not be the biggest, we may not be the fanciest, but we are the only dental clinic in Georgia that exclusively treats this patient population.
I honestly have no clue of any other place that I could possibly take her to.
No, I don't know what would I do if the DDD Foundation was not here. I really don't know what to do because I tried a regular dentist, they didn't accept her.
It has to be this place or not really any other options.
She'll be coming here for the rest of her life. Hopefully they're gonna still be here.
It's a blessing. We thank God for the DDD Foundation.
Wake up, sweetie girl. Then we can go home.
There is a misperception, I think, among a lot of people that a nonprofit means free. And the DDD Foundation is not a free clinic. We are a nonprofit clinic. About 95% of our patients are considered to be low to middle income families according to Georgia's Medicaid requirements. And so there's a gap, and sometimes it's a pretty big gap. We anticipate that this year we will have tens of thousands of dollars that are just uncollectible because patients can't afford to pay out of pocket what they owe on their accounts. Put yourself in our patients' parents' shoes. What would you do if your child needed this kind of service? What would your life be like if your child, adult or a little child, needed this kind of service and didn't exist and wasn't available to you? We ask people to dig deep into their pockets and think about life-saving, sometimes, dental procedures to help an indigent patient afford a dental procedure that they really, really need and can't afford to have. Parents come in and just weep sometimes because of just the relief of having someone besides them care for their child for a minute, and they can just sit and close their eyes and weep because their child has been acting out and they didn't know why, and then to realize they had an impacted tooth that, you know, with treatment all of a sudden resolves all the behavioral problems. It's an amazing place to work.
It's just the littlest things that make such a big deal.